This is the story of Jane Doe, a middle-aged woman of Caucasian descent, having lived in Appalachia for generations. Jane's days begin early, with the first light filtering through her small kitchen window, catching the dust that hangs in the air. Since childhood, Jane has lived in the house her grandparents built decades ago, nestled in the small Appalachian Valley of McCreary County, one of the poorest areas in Kentucky. The land has always felt like home, grounding her with its natural green beauty and history, even without the luxuries of living in an urban city, such as sidewalks nearby, fresh produce, and events at every corner. Like many in her community, she knows the land is as much a source of pride as it is of pain. She pauses before her morning cup of coffee, wincing as she stretches her back, the familiar ache flaring up again. Jane was diagnosed with scoliosis back in early adulthood. Growing up, Jane's world was shaped by the hills and rivers that surrounded her. It used to be clean enough to drink right from the stream, she remembers her father saying with nostalgia. But things changed when mining companies began mountaintop removal nearby. She saw the once green hills scarred and bare. The waters turned murky, and the air took on a strange sharpness that settled uncomfortably in her lungs. Now, years later, she thinks back to the way her chronic bronchitis developed and wonders if the dust in her lungs isn't only from her home. The toxic chemicals released into the atmosphere from the destruction to the land could be one of the main culprits, as well as the condition of her home. Since her home is decades old, far from any amenities, and their funds are relatively low, it has created an excess of mold, mildew, and degradation. These are all things that impact respiratory health, which likely stimulated her ongoing and worsening lung conditions. Jane's family, like many others, didn't have much money, and going to the doctor was a luxury often reserved for emergencies. Her parents worked hard, some as welders, taking pride in their Appalachian values of resilience and self reliance. Though useful, that pride came at a cost. Jane learned to tough it out, as was ingrained into her mindset by her family, to endure the growing pain in her back and the tightness in her chest. When she finally had to see a doctor, the closest specialist was over an hour away. Without reliable transportation, each appointment became a hurdle, and she often found herself postponing her care for months, even years at a time, due to lack of proper medical attention. One outstanding time was when she went to a neurosurgeon for scoliosis issues and was shamed for her weight when the doctor told her partner, "You've just got to lock her in a closet and only feed her water for like 2 months." This discouraged her even more from seeking help for potentially debilitating health conditions. Yet Jane has always been surrounded by a supportive network of family and neighbors. When she can't make it to a doctor's appointment, her cousin will sometimes drive her or let her know about recurrent or new community health events. For her, this close-knit community is everything, a network of people who understand the struggles of rural life. But even with this support, the lack of local healthcare resources has made her increasingly aware of how limited options can be. "I'd take a telemedicine appointment in a heartbeat," she thinks, reflecting on the exhausting trips and her mounting health concerns. Even though healthcare has evolved extensively, there are still many prevalent barriers that contribute to diminished access. Some could be mitigated by telehealth appointments. This is not by any means a clear-cut solution because more times than not, patients need direct contact to correctly emphasize their symptoms, but it is a start. After hearing about the Frontier Nursing Service, which brought health resources to remote areas, she wonders why similar services couldn't address chronic illnesses and mental health needs in Appalachia. Jane believes that community-centered outreach and care will help people like her. Increased access in these communities by facilitating transportation, consistency, and professionalism will benefit rural Appalachians and perhaps save lives or increase life expectancy. Jane believes in her heart that local community centered care could help people like her who are otherwise forced to delay or abandon their health needs. She often shares her hopes with her neighbors and family, speaking passionately about the need for health care tailored to Appalachia. Her community deserves options for preventative care, she believes, for regular checkups that catch issues before they become unbearable. When Jane talks with her friends and neighbors, she often advocates for a healthcare system that embraces Appalachian life rather than forcing its people to fit into rigid, distant models of care. Her dream is simple to her: a world where her grandchildren can grow up without fear of medical debt and where they can breathe clean air, and a trip to the doctor doesn't mean losing an entire day's plans or wages. Jane's back still aches as she stirs her coffee, and her lungs still remind her of the damage the hills have suffered. But for now, she doesn't see a landscape changed by mining. She sees the people and the faces of those in her community working toward a better future, determined to ensure Appalachia's beauty and health aren't